Today we'll be discussing treatment and prevention of substance abuse. Learning objectives differentiate between biological and psychological and environmental factors that contribute to the development of substance use problems. Articulate the definitions and classifications and criteria for diagnosing substance use disorder according to the DSM-5. Identifying biological, psychological, and environmental factors that contribute to the development and substance use problems. Summarize treatment options. Evaluate treatment modalities, including behavior therapists, pharmacotherapy, community-based problems, and their effectiveness addressing substance use disorders. And investigate preventative measures when it comes to individuals and community within the substance use dynamics. Biblical foundations. Chapter 14, verse 27. Peace I leave with you. My peace I give to you. Not as the world gives, do I give to you. Let not your hearts be troubled, neither let them be afraid. This verse offers the powerful message about the peace that can be found through our faith and how our faith can help others when addressing the issues of substance abuse and addiction. Those that are struggling with it experience different turmoils and challenges, and our relationship through Christ and our peace within Him and us will help us support others in need that are going through this turmoil. John 14, verse 27 provides a foundation for understanding how spiritual peace can be a vital component in the recovery process from addiction, guiding individuals towards healing while navigating their struggles. Factors that contribute to substance use problems. Biological factors. It can be a genetic predisposition. And we discussed how the brain is very malleable and genetics can take a role in it. And also there is a connection within co-occurring mental health disorders within substance use problems. Psychological factors. People experience adverse effects and experiences through their past, which without being treated leads to ways to numb their pain and anguish. Mental health issues can be another component. If not treated effectively, substance use can become an alternative to mend their pain and turmoil. Environmental factors. If there's an exposure to it, it becomes a normal part of their day-to-day that leads to more access to the drugs and being impacted by the drugs being within their environment. 5 model category. We will discuss different modalities within the impacts of substance use. The moral model, people are seen as personally responsible for drug and alcohol problems. Treatment consists of either spiritual and legal intervention. You have the American disease model, which is the foundation of AA and self-help groups, discusses the dependence of the product and discusses the irreversible disease within the impacts that it may cause within someone. Treatment is identify people with diseases, confronting them, helping them, and accepting and persuading them to sobriety. Biological model dependence is viewed as a genetic and physiological component, which treatment is advised through understanding genetics and the history of drug use within the components of a person, and the importance of avoidance of the drugs or alcohol altogether. Social learning theory looks at drug use and alcohol as a complex part of the environmental components that play into person being exposed and the misuse around alcohol and drug use, that addresses the social components and helping the person be aware of people, places, and things that may impede in their abstinence of their substance choice. The social cultural model discusses the subcultures and society components that shape alcohol and drug use patterns, and discusses the consequences by the norms and rules and laws that are significant around drug use and alcohol. Treatment intervention is around the effects on a larger scale of society, such as taxing sales on alcohol beverages and classifying drugs on a schedule status. Abstinence and moderation is the true controversy into treatment and how to manage drug substance misuse. Abstinence is the predominantly used treatment within modality around US and Canada specifically, and usually there's professional treatment within rehabilitation and the utilization of self-help groups such as Alcohol Anonymous or Narcotics Anonymous. However, research findings show that people identified with alcohol use disorders can modify alcohol use and still have stability on a moderate level. Controversy is there's a genetic component, and addiction can cause we come back within how our brain is wired and how we can have an addictive trait within our substance use or misuse. Research finds factors for successful moderate drinkers, less severe dependence, and a person believe in moderation is possible at a younger age, and also certain components of stability and psychological, and there's a social component like support and having stability within their environment. And these debates are definitely arising because of how we are looking at substances that were illegal and legalizing them in other states and seeing how it impacts the drug use within the state and their culture. Relapse is used when it comes from the physical disease and relapse comes up when there's a more challenge, when the disorder comes back and when you're reusing. Okay. Major models and theories of relapse mechanism. Three that are used the most is cognitive behavior model, person situation interaction model, and self-efficacy and outcome expectancies. Emphasis on relapse and participants events. It can depend on the person and their exposure and their discipline within their sobriety, and social factors and stress usually impacts the reason for relapse. Again, we discussed there's different components such as psychological, cognitive, biological components that can impede in the motivation to sobriety and the use of drugs and their cravings. We discussed a bit about the DSM-5 at the beginning, but there's different categories of substance use disorder. The definition of substance use disorder is a problematic pattern of substance use leading to a significant impairment and distress. Classification is dependence on substance or abuse of substance. There's indicators that are important that differentiates between those classifications, which is tolerance, withdrawal symptoms, unsuccessful attempts to cut down, significant time obtaining and using substance, and continued use despite social and interpersonal problems. So it impedes into your daily life. If it's impeding or you cannot function in your daily life, that is one of the significant factors of classification of disorders. Motivation to change, that is significant in any mental health or substance misuse, is what is the motivation to change will help the outcome of treatment, behavior, or psychological. The major barrier is people deny that they have a problem, and that will cause a hindrance in recovery. And so the importance is the person being ready to commit. And a lot of times within addiction, or even with mental health or any problem, you go through the stages of change and you get to the space where you're prepared and you're ready for action. There's no one size fits all, but during the 1980s, there was this significance on one size fits all 28-day inpatient treatment. However, we're looking at anything when it comes to education, mental health, substance use, it is important to look at treatment as an individualized care approach. The guided 3 principles that are used is looking at the client's problems and needs when treatment, look at the current knowledge and effectiveness of the consistency of the treatment. Is the treatment should be used in the least restrictive for the client. It has to be applied in the outside world. That's what causes the hindrance with recovery and rehabilitation, like inpatient treatment, especially in longer periods of time. It's hard to apply it to the outside world. Step to care approach. One model to follow is questions to consider when you're doing the step care approach. Is it scientifically supported? Will the person accept the treatment? And is there any improvements? Also, step care fits well with current knowledge of alcohol and drug use patterns and economic treatment delivery. Step care also fits well with the current knowledge of alcohol drug use patterns, treatment delivery within the components of the least restrictive environment, and also it being cost effective for anyone to have access to recovery. Prevention is important because it's an educational tool. It educates people about drugs on multiple levels, and it helps them to understand the adverse effects prior to the exposure. Usually that is done within the community, school-based interventions, and information through advertisements, documentaries, exposure within within social workers being available in the hospitals and different programs. It helps bring about understanding and breaks down stigmatisms. Alternative behaviors and resistance skills training. Developing replacement behaviors makes sense in theory, but no benefits have been found in evaluation programs. Information about skill building strategies is helping people develop problem solving and decision making skills, being able to be more resilient, being able to effectively see themselves as efficient or have increased self-esteem without the enabling of misuse of a substance. That is why a lot of programs such as DARE, which stands for Drug Abuse Resistance Education, is available. However, again, there's the issues of ongoing research and consistency in showing the impacts of these programs. Programs that are given to college students, especially surrounding around the education of alcohol use within college environment, has been important to address, and problems associated with drinking and food, driving under the influence, relationship conflicts, the aggressiveness within the alcohol use, and destruction of property, and also the challenges of being successful within keeping their grades up within their college experience. So within the programs that are addressed is that college students need to understand the severity of drinking and how it impacts their productivity, especially some of them are not informed of how their cognition is still being developed within those critical years. Treatment options are very important, even with college students and the youth, and preventative measures with young adults and with anyone that is exposed to substances, is to understand the root of the issues through cognitive therapy and understanding their behaviors that lead to misuse and addictive behaviors. Being exposed to the right form of medication and be informed about the medications that can help prevent and help create the progress for recovery, and being able to be informed about what substances are used for pharmacotherapy when it comes to the drugs, and the substances are used to help with recovery and preventative measures within the dependency of other substances. Again, another way that we provide information to others to provide preventative information for others is by campaigning, advertisements, warning people about the dangers of drugs. Exploring options of treatment. Again, we discuss community-based treatment, which is very helpful because you create support. You feel supported by people that understand your struggles, and that you receive resources that create a positive environment for yourself. Again, Alcohol Anonymous was established in 1935 as one of the most familiar ones, the ones that you see the most and about. 12-step program is another self-help route that helps people that are struggling with addiction and maintaining your sobriety, as well as Narcotic Anonymous. effective prevention strategies. We discuss a lot about community level strategies, but there's importance of individual level strategies and preventive measures of understanding how to cope and be resilient is a big factor in why people use drugs or drink alcohol, because they feel like they can't cope. And so when you learn these skill sets in school, and a lot of educational programs provide social skills support to help kids understand how to be resilient and make good decisions. Again, I enjoyed my time with you and hope that you learned a lot about drug use and misuse. And good luck with your educational endeavors.